Good evening, everybody. I just decided to take off my glasses. My name is Kristen Roplat. I'm an acupuncturist here in Santa Monica, California. And one of my expertise is brain health. Also, I work a lot with thyroid patients, Hashimoto patients. I'm also an expert in cellular healing. And tonight, the topic of discussion in this Google Hangout is brain atrophy and brain shrinkage. It's such a horrible thought to have your brain shrink. And I don't know if any of you are baby boomers out there, but I certainly am. I'm 63 years old. So when I watched my mom go through dementia, it was horrible and rotten. I felt really horrible for her. But when I turned 60, we were like, yikes. I mean, all my friends were like, yikes, what can we do to protect our brain? So that's why I've done so much research and so much study and gathered so much information. And I want to share a lot of this tonight with you. I've done brain webinars and the link for that. But tonight is more about brain atrophy and shrinkage. And I have a bunch of notes here, and I'm going to keep looking over to the side and referring to them. But if you want a copy of these notes, what you can do is call my office at 310-828-8258. Okay, so let's talk about brain shrinkage. So even if you're healthy, the statistic is that you may be losing 0.4% of your brain mass every year. Holy cow, that is really scary. Now, what does that do to you? I'm going to start putting on my glasses. What the heck? You guys will just be able to see me in my lovely blue glasses. But anyway, what does that mean if your brain shrinks? It means that you're going to lose cognitive function, your memory is going to get shady, you're not going to be able to have short-term, long-term memory, your behavior is going to be affected, and also your mental health. So if you do have a shrinking temporal lobe, and by the way, the temporal lobe is the way that you start to perceive hearing, okay? The way that you hear. But if you have a shrinking of your temporal lobe, you have 181% increased risk of major depression. So a lot of times we're wondering, gosh, why am I so depressed? It could be because there are things that are going on in your brain that you are not aware of, that don't seem really primary, but it is affecting your mental health. Now, this brain shrinkage is not just in older people or baby boomers. It can also be with younger people. And so in younger people who have overall brain shrinkage and they don't even know it, they have a 70% increased chance of passing away. That is scary, okay? It affects your overall health. Now, folks who are 85 years or older and they have temporal lobe shrinkage, they have a 60% increase chance of passing away. So that makes a lot more sense. But in younger people, I don't know if anybody who's younger is thinking about, oh my gosh, is my brain shrinking? But there are a lot of things that we can do to stop that process. It has to do with diet, has to do with nutrients for your brain. It has to do with keeping those glucose levels very even so that you're not eating a ton of carbs, a ton of sugar. And I know that, when I do my little tidbits for Facebook, etc., I talk a lot about don't eat a lot of sugar, don't eat a lot of candy, don't eat a lot of carbohydrates and nasty carbohydrates, and stay away from gluten. But it is very true. It really does affect the way your brain remains intact and as big as it was when you were born, okay? So there are different health can affect the way your brain functions. So if you have arterial sclerosis, and we all know what arterial sclerosis is. It's when plaque is building up in your arteries and it's restricting blood flow. And when that happens, when that blood flow gets restricted to the brain, then you have less brain nutrients to work with, and that affects your brain cells. And also you're going to have a less oxygen, which is going to cause, over time, maybe imperceptibly, the idea that your brain is starting to get smaller and smaller. All right. If anybody has coronary heart disease, and your coronary arteries feed the heart muscles, all right? So if you have coronary heart disease, that can translate into smaller gray matter. And the gray matter in the brain is, it affects your thinking and your feeling and your motor skills. So anybody with coronary, they're worried about their heart, and they're hopefully doing all kinds of wonderful things and taking all kinds of supplements and changing their diet, etc. But you'll also have to think about the health of your brain. Now, I am a big a fan of genetic testing. I think it's really important. We didn't have access to this 5, 10 years ago as a practitioner. And so to now be able to know what is happening with your genes and that you might have mutations in your genes is very helpful, because it's not a death sentence. It just means that you know you have a mutation or two in a specific gene pattern. And then we know how to fill in the gaps. It's like having a pothole, and you fill it in with the appropriate nutrients, etc. All right, so there is a gene, and I'm sure a lot of you have heard of it, called the APOE4. And if you have that gene variant, you can have, but may not, but possibly could have significantly smaller brain size in certain areas that are going to affect memory processing and emotion. Now, once again, it is not a death sentence. Certainly, this variant in this gene makes you more predisposed to having an Alzheimer's diagnosis. But once again, if you have a mutation or two with this gene, it doesn't necessarily mean that you will get Alzheimer's. You may have this gene variant in your family, but again, there are a lot of factors that are going to control the health of our brain and how we age healthy, and vital and strong. And so it's really important to really take a look at your diet, etc. And some things I'm going to talk about a little bit later. When you do a blood test and you get this blood test back, one of the markers that is very important to take a look at is your homocysteine levels. And that is an amino acid. And it is very important that it is not too high, because it affects a lot of things. Now, if you have higher homocysteine levels on a continuing basis, that can equal smaller volumes of gray matter. And once again, gray matter is going to affect the way you think properly, the way you move properly, and the way you feel, how you feel about yourself, how, your feeling of well-being. Very, very important. You wouldn't think that that homocysteine level is going to affect your gray matter, but it does. Usually the homocysteine level is a marker that people get concerned about in regards to coronary heart disease, all right? And so, everybody wants a very low homocysteine level. Now, with stroke patients, if they have higher homocysteine levels, then you have an 8.8-fold increase in the risk of brain shrinkage compared with patients with the lowest homocysteine levels that have had a stroke. Also, if you have had a stroke and you have high homocysteine levels, you have a greater risk for not only brain atrophy, but also for Parkinson's disease and Alzheimer's. So once again, that high homocysteine level is not just going to affect the way that your heart functions, but it is also going to affect your brain. Now, what makes you have a high homocysteine level? Well, one of the things that is very, very important to take into consideration is that you have adequate B vitamin levels, specifically folic acid, B6, and B12. And there is a particular test that I recommend for a lot of people, and it is called the MTHFR genetic test. And that is a test that takes a look at folic acid and how, if you have enough of a specific enzyme that will take folic acid and turn it into the active form of folic acid called 5-methyltetrahydrofolate. It is very important because folic acid and the levels of folic acid are very important in regards to keeping those homocysteine levels low. The other thing that is very important is B6. And B6 needs to be in an active form. So the active form of that you can get in a supplement form of folic acid is called MTHF, or 5-methyltetrahydrofolate. B6 needs to be in its active form as well, because once again, there are some people that have a hard time creating the active form of B6 in their blood, in their system. And once again, B6 and folic acid are going to also both affect the levels, the lower levels of homocysteine, if you have adequate amounts. All right. Now, the other B vitamin that is very important to have in adequate amounts is B12. And for the B6, you want something called P5P. You can get that at your health food store. And for B12, you want methylcobalamin, not cyancobalamin. That is that's not a good form. You want the active form of B12, which is methylcobalamin. Now, if you have low levels just of B12, then this is going to equal progressive brain atrophy with brain level losses at 517%. And that is greater than those with higher levels of B12. So you see that these B vitamin deficiencies can be very serious. And it is going to affect the way that you methylate, that you form these methyl groups. And in regards to just your whole body, and I've talked about methylation probably ad nauseum in some of my other talks, but once again, a review of methylation. Methylation is going to help your body turn on and off your stress hormones. It will help you to de-inflammatize your cells. It is going to detoxify your system. And it is also going to work with glutathione, which is your master antioxidant, to make sure that you're breaking down your estrogens correctly into safe estrogen metabolites. So it is very, very important to get those active Bs. And once again, there are a lot of supplements. There's a great supplement called Moore's by Systemic Formulas. They have all the active Bs, and that will help to keep your homocysteine levels low. All right? Now, the other thing is that you can ask your doctor to do an MTHFR test. Your doctor may or may not know what to tell you if you have a genetic variant, but I do, so you can always call my office. Once again, 310-828-8258, and I can tell you exactly what to do if you have mutations with your MTHFR. Now, let's talk about people with diabetes. When you have diabetes, your blood sugar levels are going up and down and up and down and up and down, and that's not a good thing. If you've read Dr. David Perlmutter's book, Grain Brain, you know that it is absolutely essential for brain health to keep your glucose levels very level. And if you have high blood sugar, this is going to produce something called AGE, which is called advanced glycation end products. Now, what does that do? It causes central nervous system damage, these AGEs. It causes neurodegeneration, and it causes brain atrophy. All right, so it is actually what causes brown spots. You can have AGE in your brain, you can have AGE on your skin, you can have AGE challenges in your organs. So it's very, very important that you don't have high blood sugar, because that's going to cause AGE in the brain. Also, diabetics on the average have 4% smaller hippocampal volume and 3% reduction in overall brain volume and double the risk of mild cognitive impairment. So it's very important for diabetics, even if you're on medication, there are also supplemental things and dietary things, many things that you can do to keep your insulin and glucose levels very even. So you have to look to your diet, look to reducing inflammation around your cellular membrane, so that your insulin levels, your insulin can get in and bring glucose into the cell. Very important. You do not want to live your life insulin resistant, but if you do, it's going to affect your brain. Also, diabetes results in these things called toxic misfolded proteins. They're very close to what Alzheimer's patients have. And these things, these toxic misfolded proteins, a mouthful, can damage your brain cells. Now, let's take a look at people who are obese or who are overweight. And this is a serious problem. And this is not from what you look like point of view. It's actually from a health point of view. And so when your practitioner says, listen, you need to lose weight, it's not because we're commenting on how you look. It's because we want to protect your health. And this is very important. So when you have fat deposits all over your body, what this does is it produces these inflammatory cytokines. And these cytokines can contribute to brain cell death and lower brain volume. It's really serious, okay? Now, the other thing, there's another gene that I want to talk about called the F as in Frank, T as in Tom, O as in Well. Okay, FTO gene variant. So it's said that 46% of Western Europeans and descendants could have this gene variant, and this is associated with obesity. All right, and if you have this gene variant, it's possible that you have an 8% smaller frontal lobe. And the frontal lobe is going to affect things like cognitive skills, emotional expression, problem solving, memory, language, etc. So this is not a judgment, sexual behavior, all that. So it's basically the control panel of our personality and our ability to communicate. The other thing is that if you have an FTO gene variant, what's going to happen is you're going to have a 12% smaller occipital lobe, which your occipital lobe is, it processes visual information, from your eyes. So this gene, it's not affected by cholesterol or high blood pressure or anything. So with this variant, you can have these challenges. So what I'm saying is that it's really, really important to deal with your diet, to deal with becoming a fat burner for energy instead of a glucose burner for energy. And I can help people with that. I can show you how to change your diet. And, I give different diets for different people, but it's still very, very important to follow something that is going to allow you to shed those pounds so that you become a fat burner. It's really healthy for your brain. Now, this is kind of shocking. And this is in regards to sleep and the brain. So if you have shorter duration of sleep, that is going to equal perhaps smaller brain volume. And for every hour of reduced sleep duration, there is 0.6% decrease in cognitive performance. And I have to tell you, I don't sleep a lot because I work a lot. And so when I saw this, I was like, yikes. There was also a study with middle-aged women with long-standing emotional stress. So they were depressed, or they were anxious, or they had a combination of the two, or they had a lot of stress on their job. 51% increased risk of moderate to severe atrophy of the temporal lobes. So this is no joke. It's affecting how big your brain is. All right, so let's talk about how to protect brain volume. Obviously, what you want to do is you want to increase the amount B vitamins. That is an understatement. So you can take mores. You can take, there are all kinds of active B complex vitamins, but mores is what I use in my practice by Systemic Formulas. There was a study. One group took 800 micrograms of active folic acid, or 5-MTHFR. I can't even talk today, and 500 micrograms of B12. And in 2 years, there was a 30% slower rate of brain shrinkage, even if they had higher homocysteine levels. If they supplemented with those active Bs, they had a 53% slower brain shrinkage than unsupplemented groups. So get those Bs. Also, for Alzheimer's patients, brain areas most susceptible are more protected with B vitamins. A 7-fold reduction in brain shrinkage of those brain areas that are affected in Alzheimer's, and 30% slower cognitive decline. So anybody that you know that has Alzheimer's, it's vital that they get some active B vitamins into their system every single day. A bath, a wash of those available Bs, all right? I want to talk a little bit about some of the foods that are going to help increase those B vitamins, if I can find this in my notes. So for folic acid, food sources are fruits and vegetables, beans and grains. I'm not a real big proponent of grains, so I would say more fruits, vegetables, and beans. For B6, good sources of B6 are beans, poultry, of course, grass-fed organic, fish, wild but not, and just those obviously not high mercury fish. Some vegetables and fruits, especially dark green leafy vegetables, my favorites, papaya, oranges, and cantaloupe. And for B12, food sources would be fish, poultry, grass-fed meat, organic eggs, and A2 cow organic dairy. We can talk more about that later. But that's really important. And it's really nice to be able to increase the amount of those kinds of food that you're eating if you feel that your B vitamins are really low. Now, also omega-3s, and I want to talk a little bit about omega-3s. Everybody knows that omega-3s, especially DHA, part of the omega-3s, are going to really help nourish the brain and protect you from brain excitement, too much brain excitement. And they're going to be anti-inflammatory to your whole body and to your brain. But higher omega-3 index equals larger brain volume. However, I want to make sure that we don't get too much omega-3s, because we're not getting a really good ratio between omega-3 and omega-6. There's a product, a twin product or combination product called Vista 1 and Vista 2 from Systemic Formulas. As you can tell, I like Systemic Formulas. And it's a perfect ratio, and it is great for brain health. It starts to heal not only the cellular membrane of the brain, but also of the mitochondria. And that is where you make your ATP energy, but you've had mitochondria in your brain cells as well. So it's a very important thing. So if you have an overabundance of omega-3s from taking too much of it for too long, and you don't have that balance, you start to get soggy cells, and that is not going to be good for your brain. So Vista 1 and 2 from Systemic Formulas, I have it in my office. Once again, you can call 310-828-8258. All right, let's go on to pomegranate. Oh my gosh, I wait for the fall when pomegranates are abundant. I love pomegranates. I like tearing them apart. I like eating every individual seed. I like staining my fingers. I love it. But anyway, pomegranates, high levels of polyphenols, which are abundant in pomegranates, include inflammatory molecules with neuroprotective properties, which is awesome. So they did a study and they showed that taking 8 ounces of pomegranate juice per day slowed down brain atrophy and brain cell death, which is awesome. But also, I just wanted to, this is a plug for pomegranate juice because it's going to improve the blood flow to your heart with people with coronary heart disease. And it is said that it may stop plaque formation in your arteries. So anybody who has those concerns, any plaque buildup, pomegranates are the key. And there's some great pomegranate supplements out there too. You can call my office and find out about that. Lastly, I want to talk about resveratrol. And resveratrol is great because it is an amazing antioxidant, and it is a big-time anti-aging antioxidant. You get it from grapes, all right? But not eating grapes because there's too much sugar, too much high sugar in grapes. So don't go eating a bunch of, grapes. But in a 2014 study, there were people that were supplemented with 200 milligrams of resveratrol per day, and they saw an improvement in connections between the hippocampus and the frontal areas of the brain, which means that their memory, their brain function, everything is going to be increased in a dramatic rate. There was an animal study done 4 weeks on resveratrol. The animal's activity, energy activity increased by 20%, which means that there was possibly reduced brain cell death and a larger hippocampus. All right, so what does this mean, guys? It means that we need to really do all the things that we can do to take care of our brains. And please, don't just say, oh, whatever, my brain's fine. I'm not going to sit around and worry about it. I already have to worry about this, that, and the other thing. But if you don't go through life with a brain that is intact, is the perfect size, then slowly, 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 over time, you're going to slide down into a bad place, and your elder years are going to be spent struggling and eventually not even knowing who your kids are, not even knowing who you are, not being able to function, and then you're going to be having to be taken care of by somebody, and none of us want that. So I'm really excited that y'all came to this Google Hangout. And once again, if you want the notes, you can call my office, 310-828-8258, and get those notes. And I'm really excited to talk to any of you who want to get on a brain health program. I have a great one. So thank you all very much for coming to this Google Hangout. And in a couple weeks, I'm going to do another one. Oh, and by the way, one more plug. An article on brain health is going to be in the October 2015 issue of Life After 50. So look for my brain article. Okay, thanks a lot. Bye.